Welcome to the show. Today we are going to be talking about coronary heart disease, which is the leading cause of hospitalization in the US and in Malta. We are here with Sandy and Rebecca, who are specialists in the field of aging. So, Sandy, can you give us a definition of CHD, please?
Well, actually, I'd like to start by saying it's not only the leading cause of hospitalization in US and Malta, it's also the #1 cause of death in both US and in Malta. CHD, it's the narrowing of blood vessels that supply blood oxygen to the heart, and it's also called coronary artery disease.
Okay, so Rebecca, could you tell us, how does this happen?
Well, fatty materials and other substances form plaque in the heart arteries. This is known as hardening of the arteries. Actually, coronary arteries bring blood and oxygen to your heart. So this building causes the arteries to narrow, which will actually slow down the blood flow or actually stop.
Interesting. So, Sandy, what puts you more at risk for this to happen?
Well, firstly, your age. The older you are, the higher risk of getting coronary artery disease. And then there's gender. Men are actually at higher risk than women who are still menstruating.
Oh, so does this mean that women after menopause are more or less at the same risk level than men?
Exactly.
Your race and genes are actually important factors to consider as well. So if you have close relatives or your parents that suffer from heart disease, you actually have a higher chance of getting heart disease.
These are, of course, things you can't change. Other more preventable factors which also increase the risk of CHD are diabetes, high blood pressure, smoking, chronic kidney disease, being overweight and not getting enough exercise. And also feeling depressed and also excess stress.
Okay, so could you tell us some of the symptoms which might come up if someone is suffering from CHD?
Well, symptoms can be very noticeable, but can also not be present.
That's true. Some of the most common symptoms tend to be chest pain and discomfort, fatigue, and overall weakness.
Okay, so let's look at a video detailing what happens to the heart when someone has CHD.
Heart disease in the coronary arteries occurs when they become clogged from a buildup of cells, fat, and cholesterol. This buildup is called plaque. As the inside of the coronary arteries gather plaque and become narrow, they decrease the flow of blood and oxygen to the heart muscle. Without proper blood and oxygen, the heart muscle eventually weakens and begins to wear out. This decreases the heart's ability to pump normally. When you are doing an activity that requires physical effort, your heart muscle demands more blood and oxygen. But if the heart is not pumping effectively, this need cannot be met. As a result, you may experience symptoms such as angina or chest pain, irregular heartbeats, and shortness of breath. These symptoms may indicate heart disease.
Wow, that was a very illuminating video about CHD. Let's move on to our interview with cardiologist Dr. May. With her, we'll be exploring various treatment options for people with CHD. So, doctor, could you tell us some more about CHD?
Well, firstly, for medication, depending on the symptoms and the severity of the disease, I usually prescribe aspirin to help prevent blood clots in arteries, diuretics to lower blood pressure and treat heart failure, and nitrates to stop chest pain and improve blood flow to the heart. However, a cardiac rehabilitation program is necessary to improve the heart's fitness. This incorporates more important measures than medication, such as a proper diet and lifestyle.
Okay, so what would be an appropriate diet for people with CHD?
Well, it's a diet rich in fruits, vegetables, and whole grains. It's important to have lean proteins, those with little fat, such as fish, beans, and chicken. Then a lower intake of dairy products is recommended, so less cheese, cream, eggs, etc. And of course, sodium should be avoided at all times.
Okay, so it seems like quite a healthy diet to me, not too restricted.
It can't be too extreme, otherwise no one would ever stick to it. Actually, a healthy diet for people with CHD is essential, and so it must be adhered to properly.
Yes, you really need to reduce the fat intake, after all. CHD is caused by fatty substances building up in the heart vessels.
That's right, fatty substances and other materials form plaque, which causes the buildup in coronary arteries.
Now, apart from the diet, you mentioned something about the lifestyle. Could you tell us some more about that?
Yes, lifestyle. When coping with CHD, it's about the lifestyle choices one makes. First and foremost, it's vital not to smoke or use any kind of tobacco. As for alcohol, a limited intake is acceptable. Of course, plenty of exercise is needed. Approximately 30 minutes a day, 5 days a week. Exercise and nutrition are needed to keep a BMI range between 18.5 and 24.9. Lastly, there are psychological lifestyle issues to be dealt with. Some patients with CHD may experience depression, either as a risk factor contributing to CHD or as a result of the condition.
I see. So, in such cases, should patients seek treatment?
Yes, if it's depression or any other psychological distress factor, like anxiety, I encourage them to see a psychologist for such treatment. This is necessary, especially since they can either directly or indirectly affect treatment of CHD.
And would these various treatment options speed up recovery? What can one expect?
Well, everyone recovers differently. Some recover with diet, exercise, and lifestyle changes, and others may need medical surgery, such as coronary artery bypass surgery. Most of my patients have told me that they receive good levels of social support, especially women under 65 and men over 65. The sicker people are and the more comorbid conditions they experience, the less is their health-related quality of life. It's important to note that changes in social support is a predictor for changes in health-related quality of life. Additionally, high levels of social support and positive changes in social support decreases heart failure-related hospital admissions. Most of my patients felt that their quality of life was positive. Health promotion services offer a wide range of counseling and education on exercise, diet, and tobacco use, which is meant to encourage younger people who are healthy to make healthier life choices, moderate and change unhealthy behaviors. I believe that counseling and education on coronary heart disease can improve quality of life, as individuals will be able to decide among a range of healthier options and thus enjoy their life more without compromising their health.
Okay, thank you very much, Doctor. Okay, so now let's turn to the panel discussion. With us here we have Dr. Beiruti, who is going to elaborate a little bit more about CHD.
All right. So as I was saying earlier, CHD is the #1 cause of death in Malta and in US. And according to the latest World Health Organization statistics, which were published in April 2011, coronary heart disease in Malta reached 28% of total deaths. And it also ranks number 117 in the world. Moving on to psychological distress leading to CHD. It was found that in men, baseline psychological distress was associated with increased incidence of overall self-reported CHD. And this is also after adjustment for age, employment grade, and length of follow-up. In women, psychological distress was also associated with increased CHD. Adjustment for health behaviors, marital status, social networks, work characteristics reduced the risks for incidence of CHD by 12% in men and 10% in women. Psychological distress may have a direct influence on CHD. It's independent of behaviors or psychosocial factors. It can be by neurohormonal activation related to secretion from the hypothalamic pituitary gland. Negative mood states and environmental conditions might all act through a single pathway of these factors and have independent effects on CHD risk. Now moving on to chronic anxiety as a risk factor to CHD. It can also, as I explained before, can be increased by influencing health behaviors, again smoking, so it's an indirect influence. It can also trigger fatal coronary events because when you're more anxious, your heart starts beating faster, so it can cause plaque rupture and coronary vasoplasm or thrombosis. While the symptoms and signs of coronary heart disease are noted in the advanced stage of disease, most individuals with CHD show no evidence of disease. Often a sudden heart attack finally arises, so therefore you won't realize you have CHD, but some of the symptoms don't even show up, and then suddenly you get a heart attack, and that's when you would go and get checked. Then you might have a diagnosis of CHD. It's also the most common cause of sudden death. According to the present trends in the US, half of the healthy 40-year-olds will develop CHD in the future, and 1 in 3 healthy 40-year-old women. Just as a side note, Northern Ireland is the country with the most occurrences of CHD. And by contrast, Africa has almost no heart disease.
Okay, thank you, Dr. Beiruti, for the very interesting look into psychological distress, chronic anxiety, and the links between CHD and those. Now we're going to turn to Dr. Fitzpatrick for a look into patients' key experiences after coronary artery bypass grafting.
Exactly. As we mentioned in the beginning of the show, coronary heart disease is the leading reason for hospital admissions for patients over 40 years, as was found in research by Ligard and Fegerman. These authors also found that post-operation pain after the surgery, different experiences came about it, such as that although supportive relations also aid in recuperation from bypass surgery, life after going to the surgery can be a lonely place, as many of these survivors found it to be a key existential experience to share and explain with others. Feelings such as near-death experiences and of relief and grateful for having survived. The authors in fact called this the paradox of surviving alone with supportive relations. Fegerman and Ligard also found that people who undergo this surgery had their sense of self disrupted. This means that not only they feel the physical changes, but also started experiencing feelings of no longer feeling at home in their own body, hallucinations, disorientation, and a sense of losing the grip. Studies have found changes at the level of existential meaning, which are reflected in the patient's life, mood swings, their vulnerability, and grieving over no longer being the same person they were before the surgery, and the unfamiliarity for them of such feelings. Another key experience found by these two authors is the feeling of loss. The feeling of loss can be something as minor as discomfort, whilst getting dressed, to serious distress at no longer being able to fulfill previous everyday roles. One important loss was the sense of not receiving enough emotional support from the family or health personnel, and another was that they experienced the loss of no longer having their former independence. These problems were often solved by taking it one day at a time and concentrating on daily routines, when the patients felt physically able to get on with life. Fear also played a play after the surgery. Fears of, for example, what the future might bring, or of having a new heart attack, or never being fully restored, was one of the feelings that they experienced. Women were worried about becoming a burden to others, whilst men where the feeling was associated with the fact that their working life might have come to an end. Anxiety about chest pains, possibly returning, was shared by both male and females. Despite the fact that the operation needed for CHD was perceived as a highly intense experience and a greater than expected challenge, patients concentrated on mastering everyday life and getting on with it after the surgery. It appeared that patients needed to reach a point where they could take a grip of themselves and make a decision to get well.
Okay, so we can see that surgery does have an effect on the patients.
Yes, indeed it does.